In Soweto, like the rest of Gauteng province, cases of the Omicron variant are soaring, rising faster in fact than they did in previous waves, including the highly infectious Delta. A worrying sign.
Probably 50% of the samples that we're testing are now positive. So it feels like in the space of a week, maybe 10 days, we went from nothing to huge amounts of positives. It's very scary actually when we're doing the analysis. We didn't see that sort of increase when we were during Delta or Beta or during the second and third wave. It's definitely this one. It's taken off like we haven't seen before.
South Africa is one of the continent's leaders when it comes to vaccination, but they've immunised not even a quarter of their population. In the UK, we've done nearly everyone and are now offering boosters to all. A strategy that the WHO has now openly questioned for the first time.
It's tough for some countries who have huge amounts of excess vaccine to decide who would give it to, but that's not the problem been faced by a lot of countries around the world who can't get even primary vaccination to their most vulnerable. So it's a luxurious position to be in if you're in a position to be able to have enough vaccine to do that. Right now, there is no evidence that I'm aware of that would suggest that boosting the entire population is going to necessarily provide any greater protection for otherwise healthy individuals against hospitalisation or death.
Many UK health officials might disagree, with cases here averaging more than 40,000 a day and many over 40 still needing a booster. But the WHO's criticism didn't end there. Travel bans punish economies and could make countries less likely to report new variants.
Certainly, if there is any disincentive, if countries feel like they will be penalized for reporting that information, that is, of course, a worry for us. We, rely on this information, quite frankly, and we need to somehow figure out that all of us are either in this together or we're not. You cannot have a pandemic in part of the world and not in others.
A point not lost on South Africa's president on a visit to Nigeria.
These bans must be removed, they must be lifted, because you do not try and contain a virus through imposing bans unscientifically and indiscriminately. In fact, we should be applauded as South Africa for having alerted the world about this variant that is now beginning to spread around the world.
The world is watching and waiting to see if this latest variant is worse than what's come before. But until everyone has had a vaccine, others will come along soon enough. Tom Clark, Sky News.